Friends, colleagues, good afternoon and welcome to our completion ceremony. So I am Earl and I will be your moderator for this afternoon's event. Just a few reminders before we continue. Please make sure that your audio is muted as a gesture of respect to the proceedings. And of course, make sure that your names displayed reflect your actual name and your affiliation. Turn your videos as requested during the course of, again, the completion ceremony. And we would like everybody to enjoy and celebrate this achievement. Friends, let us acknowledge the people behind NurseLEAD. Nurse leaders, bilang pag-aalay sa ating inang bayan, sabay-sabay nating awitin ang ating pambansang awit.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, ay masasinanganan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, kuya ka ng magiting, sa manluluping, di ka pasisigil, sa nagagang tutok sa simoy at sa langit ng bagaw, ay hinagang tulakawin sa pagkayang nilakasal. Ang isang ng matawag mo'y tagumpay na nag-iingin, ang bituin at araw niya kailan pang ay magtitingin. Lumanang araw ng warhabit pagsika, buhay langit sa piling mo. Ang hinigaya na partay mga amin, ang mamatay ng dahil sa'yo.
To officially welcome all of us to this completion ceremony, we welcome on the virtual floor the project director and the dean of the College of Nursing of the University of the Philippines, Manila, Professor Dr. Sheila Bonito. Dean, good afternoon.
Thank you, Earl. Magandang hapon po sa lahat. Ang haba naman ng palakpak. Today, we are ending the training of the 4th batch of the public health nurse leaders who heeded the call and started the journey with us towards this chosen path of caring for individuals and populations in public health setting. Congratulations to all of you, our nurse leaders, on completing the course. You have done well despite juggling so many competing priorities. As we have discussed over the past few weeks in the course and during our Zoom sessions, there are many challenges that we are facing to implement the universal health care and to achieve our commitments to deliver on the health outcomes and sustainable development goals. We hope that through the course, we have provided you with some insights and possible solutions, as well as support for you to continue doing your best as public health nurses. We have more plans of building our community of practice of public health nurse leaders, and we want you to be part of it. At this point, let me thank our program sponsor, the Johnson & Johnson Foundation, through the Global Community Impact, who believed in our vision of public health nurses, leading the implementation of universal health care and achieving the health outcomes for the Filipinos. Thank you also to our partner, the Department of Health, through the Health Human Resources Development Bureau, led by Dr. Pretzel Tolentino, for supporting the role of public health nurses and allowing them to grow in the profession within the public health system. We hope that we will continue supporting each other to address the long-term needs for nurses in every barangays and to advance public health nursing practice in the Philippines. Thank you also to our invited resource persons who have developed the course with us and up to now have been sharing the journey in implementing this program. Thank you to our module coordinators, the capstone project coordinators, our teaching assistants, the products of this NurseLEAD program as well, for sharing their time and their own experiences in public health. And also our course team who stayed on with the project, who really are devoting their time and energy in ensuring that everything is in place. And finally, to our new nurse leaders, as we close this online course, we hope that we also opened a new chapter in your lives. There's much to do as nurse leaders, managers, and collaborators. And we look forward to meeting you again in our NurseLEAD Summit, hopefully next year in Clark, Pampanga. So more power to our public health nurse leaders. So see you soon. Thank you.
Thank you so much, Dean, for making this program possible for our nurse leaders. Now, in recognition of this achievement of yours, our dear nurse leaders, would like to hear messages from special people, starting off with the message from the Chancellor of the University of the Philippines, Manila, Professor Dr. Carmencita David Padilla.
UP College of Nursing Dean and NurseLEAD Coordinator Dr. Sheila Bonito, faculty, staff, and students of the College of Nursing, graduates, guests, good afternoon. Congratulations to the nurses who have completed 148 hours of virtual sessions of the leadership course for advanced practice in public health nursing, or NurseLEAD, and who joined the batches of nurse leaders from the past 3 years, now better prepared and trained to serve the people. Since its launch on September 10, 2019, this has become a formidable program of the UP College of Nursing and Johnson & Johnson Global Community in advanced nursing practice. It's focused on enriching the nurses' competencies and extending primary health care and other population-based health services is aligned well with our major health programs such as the universal health care and the Sustainable Development Goals. Meanwhile, augmenting their skills in collaborating with relevant stakeholders and agencies in the management and delivery of primary health care services and programs complement well the guidelines for the management of the COVID-19 pandemic. It is not surprising if nurse graduates of this program deployed in different communities are now being recognized as having contributed to the continuing reduction in cases the past few months. We commend the College of Nursing for fulfilling this task of training our frontliners in a higher dimension. This year alone, several courses and trainings conducted by the college in partnership with the Department of Health and other groups have advanced the frontiers of nursing in a wide range of leadership areas. Their graduates are now practicing in different strategic places nationwide and sharing and influencing others to do the same. Essentially, nurses who are the main players in the universal health care and SDG implementation are expected to bring a lot to the table in terms of advanced leadership abilities and training. NurseLEAD continues to prove to be a vital leader in this category. These unprecedented times call for no less than public health nurses adept at professional development, advocacy, and interprofessional collaboration and communication and teamwork. Filipinos deserve excellent nurse leaders, and NurseLEAD is showing the way. Those who are able to manage effectively and efficiently public health interventions, provide integrated services along the continuum of care, and are well-versed with project management and cycles and financial management principles are considered game changers. When I welcomed you during the opening ceremony, I mentioned that you will come out of this training not just carers, but nurse leaders, educators, and researchers. Now it is time for you to go out there and be health movers for a healthier Philippines. Once again, congratulations to all of you, newly certified nurse leaders. The Filipinos are happy to be the beneficiaries of your commitment, training, and service. Mabuhay kayong mga bagong NurseLEAD graduates. Nawa ay biyayaan kayo ng may kapal, ng sigla, talino at pagmamahal, tungo sa makabuluhan, mahusay, at mapagkalingang serbisyo sa mga komunidad ng ating bansa. Magandang hapon po muli sa inyong lahat.
Maraming salamat, Chancellor Padilla, sa pagkilala sa ambag at magiging ambag pa ng ating mga nurse leaders. Now, at this point, let's hear it from our partners from Singapore. Let us welcome the Southeast Asian lead for Johnson & Johnson Foundation, Wen Tan, for her message.
Good day, honored guests, nurses, and attendees. It is wonderful to see you here today. My name is Wenyi, and I'm a part of Johnson & Johnson's Global Community Impact Team here in Asia. First off, congratulations from Johnson & Johnson Foundation on completing the UPCN NurseLEAD program. We are so excited to see the positive change you'll be making in the years to come. At J&J, we have a long legacy of supporting and championing nurses and the critical role you play in elevating healthcare systems worldwide. Frontline health workers, especially nurses, midwives, and community health workers, are often the first and only link between communities and health systems. You are also part of your local community, sharing its culture, strengths, vulnerabilities, and you can shape and deliver effective interventions to meet the needs of patients, families, and communities. The World Health Organization recognizes how crucial nurses are in achieving universal health coverage. They also recognize that investing in nurses, as we are doing, but also as you are doing, by committing your time, is good value. There are 4 parts identified in the WHO Global Strategic Directions for Nursing and Midwifery, one of those being strengthening nursing and midwifery leadership throughout health and academic systems, which is why we are so glad to ally with UPCN, with their recognized strengths in nursing education. Our collaboration aims to support effective leadership and management. Nurse leadership is critical in strengthening primary and community health systems at every level, and we are pleased to support you, future leaders, through this program. Together, we can build and strengthen our health workforce to provide high-quality care and ultimately help improve health for humanity. We wish you all the very best in your future endeavors, and thank you so much for all that you do.
Our heartfelt gratitude to J&J for investing in our human resource for health and among nurses, to nurses in particular. So this time, let's hear it from the Department of Health, Health Human Resource Development Bureau. Let us welcome the OIC, Dr. Pretzel Tolentino, for her message.
Good afternoon and congratulations to all our graduates of the NurseLEAD program, Advanced Practice in Public Health Nursing. And thank you to our partners, the UP College of Nursing, for training our nurses to be leaders in the health sector. So aside from the DOH disseminating and supporting and advocating this program, we are the recipients of your graduates. So kami po ang recipients sa mga
Our apologies again for the technical difficulty that we're having right now. Again, our apologies for the technical glitch that we have encountered earlier. So we move on with the program. So we'll try once again to hear it from Dr. Pretzel Tolentino.
Good afternoon and congratulations to all our graduates of the NurseLEAD program, Advanced Practice in Public Health Nursing. And thank you to our partners, the UP College of Nursing, for training our nurses to be leaders in the health sector. So aside from the DOH disseminating and supporting and advocating this program, we are the recipients of your graduates. So kami po ang recipients sa mga nurse leaders na napoproduce ninyo out of this program. And we are excited in welcoming them back in their respective facilities. And because we are expecting that these nurses will be our partners in implementing universal healthcare. So yung mga nurses po natin sa RHU, we hope that they would assist in establishing the primary care provider networks, in integrating the services into primary care services na hindi na po yung shift natin from programmatic to service approach. And also yung ating mga nurses sa hospitals, you will be our partners in establishing the healthcare provider network. And right now, yung mabigat na problema po sa ating mga hospitals, yung migration ng ating nurses, we hope that you could manage that at your own facilities. So, with that, we are excited sa pagbalik ninyo sa inyong mga facilities, and we hope that you would share our vision of the universal healthcare. So, allow us to share this short video of our UHC vision.
Sa bisa ng batas na Universal Healthcare Act o ang RA 11223, ang buong kagawaran ng kalusugan ay kumikilos para maisakatuparan ang pangarap para sa lahat ng Pilipino ng kalidad at abot-kayang serbisyong pangkalusugan sa oras ng kanilang pagkakasakit. Ang mga sumusunod ay hindi lamang ngunit kasama sa layunin ng Universal Healthcare para sa lahat ng pasyente. Una, naaagapan ang sakit nang hindi ito lumala. Pangalawa, nakakakuha ng sapat at epektibong lunas. At pangatlo, may tuloy-tuloy na ugnayan sa primary care provider. Ano ang ibig sabihin ng pangarap na ito para sa mga ordinaryong mamamayan ng ating mga bayan at lalawigan? Hayaan niyong ilarawan namin sa pamamagitan ng kwento ni Juan at Juana. Sa kanilang pagtungo sa primary care provider, ang bawat Juan at Juana ay mapapaliwanagan tungkol sa kanilang mga benepisyo mula sa primary care provider at sa buong provider network, pati na ang kanilang responsibilidad bilang mga mamamayan ng kanilang komunidad. Sila ay napagsabihan din tungkol sa mga iba't ibang pasilidad na kabilang sa primary care provider network kung saan sila ay magpapalista sa katulad ng mga butika, mga laboratorio, diagnostics, specialist clinics at mga ospital na kabilang sa network. Sila din ay nabigyang kaalaman patungkol sa iba't ibang serbisyo sa primary care, pati na ang pagkakaroon ng transportasyon para sa referral, ang oras ng pagbubukas at pagsasara ng mga pasilidad, at ang kanilang consent para sa pagbabahagi ng kanilang medical records para sa pag-aayong surveillance at monitoring system sa kanilang bayan at probinsya. At sa pagsusuri sa mag-asawa, napag-alaman ni Juan na siya ay may diabetes at silang dalawa ay nabigyan ng impormasyon patungkol sa sakit na ito sa pamamagitan ng risk-based health literacy program. Bago sila umuwi, kinuha ang mga contact numbers nila at sila ay pinarehistro sa EMR at binigyan ng access para sa mga online appointments sa mga doktor. At dahil nakalink ang mga records sa mga pasilidad ng network, hindi na kinakailangang ulitin ang mga pagsusulat sa mga forms at mga laboratory exams ni Juana kapag siya ay ni-refer sa espesyalista o sa ospital. Paano magsisimula ang pagtupad sa pangarap na ito? Marahil ay ito rin ang pinangako ninyo sa inyong mga nasasakupan noong panahon ng kampanya. Magsisimula ang lahat sa pagpapatayo at pagsasaayos ng primary care facilities sa bawat bayan, lungsod at lalawigan o maging sa mga barangay kung kinakailangan. Ang mga primary care facilities ang magsisilbing frontliner sa lahat ng mga karamdaman ng mga mamamayan sa komunidad. Ito ang mangangalaga sa kanilang kalusugan, magbabantay ng kanilang sakit upang maagapan ang komplikasyon at tutulong upang maiwasan ang iba pang sakit. Mayroon ng mga panuntunan mula sa DOH hinggil sa primary care facilities. Malaki ang magagawa ng inyong suporta sa mga primary care facilities tungo sa katuparan ng UHC.
Again, congratulations to our nurse leaders and mabuhay kayong lahat.
And move on to the next part of our program. We are on with one of our nurses to deliver her mission as president of the National Association of Public Health Nurses Incorporated. Friends, let us welcome on the virtual floor Dr. Cora de los Angeles. Cora, good afternoon po.
Magandang hapon, co-public health workers and colleagues. Binabati ko ang mga participants Year 2 Batch 1 na nakakumpleto ng kurso sa NurseLEAD sa araw na ito. The Code of Ethics for Filipino Nurses issued by the Professional Regulatory Board of Nursing in 2004 states that all registered nurses must maintain loyalty to the development and growth of the nursing profession. This can be achieved by being a member of a professional organization. So let me tell you about nursing organizations. There are 23 nursing organizations recognized by the Professional Regulation Commission. Many are called nursing specialty organizations, like ADPCN for Deans of Nursing Colleges and Nursing Educators, ANSAP for Nurse Administrators, CCNAPI for Critical Care Nurses, and LPGN for some nurses in government healthcare facilities, or NAP and MCNAP, ONAP, at marami pang iba. Others are called nursing interest groups, or the non-clinical fields, but whose interest cuts across the specialties, like the Philippine Nursing Research Society, now named the Global Society for Philippine Nurse Researchers, and the Nursing Informatics Association of the Philippines. Then, of course, we have the Philippine Nurses Association, or the PNA, PRC's only accredited professional nursing organization in the Philippines. How about the Organization of Public Health Nurses? We have the National Association of Public Health Nurses, or NAPHN. This was incorporated and registered with the Securities and Exchange Commission on December 1, 2021. NAPHN was officially launched last April 7, 2022, or 4 months ago, during the NurseLEAD Summit held face-to-face in Clark, Pampanga. There are good reasons why we need a specialty organization for public health nurses like you. Foremost, we need to be united as one strong group whose members are are bound by these objectives. First, raise the standards of public health nursing practice by providing continuing professional education, training, and related experiences. I think it is high time we make known to the health sector and the public our valuable contribution to the healthcare delivery system. Hindi masyadong kinikilala na ang public health nursing ay isang specialization. We are happy that you have enrolled in this course. This is an example of continuing professional education that will produce leaders in public health. Many of you, if not all, already have the skills to provide health services to individuals, families, and communities. It would be best if you have enhanced competencies to manage health units at different levels. About informatics, develop policies, design advocacy programs to self-regulate, and those topics you acquired from this course. Second objective or reason, lead the development of public health nursing career pathways. What do I mean by this? We must chart our career in public health as advanced practitioners. We need to have our sense of professional autonomy in public health while working collaboratively with others. As a professional specialty, we need the NAP-HN to finalize the advanced practice in public health nursing according to the career progression and specialization program for a nursing profession. Career pathway refers to progression to level 7 or post-baccalaureate nursing, which is the master's level or its equivalent, and level 8 doctoral level or its equivalent, including public health nursing. Certification signifies the specific competencies and expertise of a nurse. The PRC and the Board of Nursing issue the certification upon endorsement of the recognized and credentialed specialty organization. And in public health, this is the NAP-HN. The third objective or reason is to establish networks and linkages with relevant national and international organizations, leading to a dynamic community of practice. The NAP-HN can communicate and link up with public health organizations and agencies in the US, Europe, Asia, and WHO upon its formal recognition. Fourth, collaborate with other organizations and unify all sub-specializations of public health nursing. In the Philippines, we have public health nurses who are members of ONAP and NLPGN. They retain their membership in these organizations. We will attempt to unify ourselves in terms of mission and goals and directions to enrich our practice in different fields or subsectors in public health. Fifth, strengthen the link between public health nursing education, practice, and research. We understand this statement as these three aspects are mostly must closely interact. Next, contribute to public health practice and policy decision making through evidence-based research and projects relevant to implementing universal healthcare. Thanks to NurseLEAD, the advanced course you completed, in helping you achieve this objective. And the last objective, to advocate for the general welfare of public health nurses. We need NAP-HN to provide leadership and provide voice and visibility for public health nurses who deserve to be given just compensation, benefits, and privileges. On behalf of the Board of Trustees, we invite you to become members of NAP-HN, the first and only organization of public health nurses in the Philippines. Right now, we have a total of 122 members. Please visit the NAP-HN FB page on the screen, and you can download later on the membership application form, which gives you also instructions on how to go about it. So cheers, everyone.
Thank you so much, Dr. Nuevo, for giving us an overview of the National Association of Public Health Nurses and for inviting our nurse leaders to take an active role in shaping the future of Philippine public health practice. Friends, the moment you've all been waiting for. Let us recognize the graduates of the first batch for year 2 of NurseLEAD. Let us look at how many of you represent the areas of the country. And now, the faces behind those numbers representing the different regions of the country. Starting on with the candidates coming from Luzon. Mabel Abella, Catalawan, Quezon. Ellie Rose Abufal, Cagayan Valley. Marlon Alberto, Central Luzon. Ann Suzanne Atienza from Central Luzon. June Ian Balance from Ilocos. Annalyn L. Banicod from Baguio City. Karin Joyce Benavides. Marsal Bonte. Nicole Marie Bugari. Vanessa Cabrera. Edwin Marquiel Canizal. Lovely Loy Collado. Alberto Villan III. Cecil Easton. Franz Andrea Esguera. Lawrence Espina. L. Anserel Pinto. Celito Nicky Ross Gonzalez. Bridget Endok Ignacio. Ruby Eileen Manago. Isabel Marano. Flor Emilia Pre. Mark Anthony Ingat. Marian Rose Notario. Mary Ann Olpindo. Alexander Francis Canod. Eugenio Carlos Parada. Jenny Inza Pelato. Homer Reitas, Desiree Susan, Feredi Torino, Etelreina Hernandez, Daryl Tapaya, Andre Dominic Calaga, Michelle Perones, Danica Ana Tolentino, Marlene May Vasquez, Hello May Iado, Mar Clyde Villaviray, Rochelle May Visitacion. From the Visayas, let us welcome Lerio Castro, Jandy Janiso Noble, Maria Telma Estanes, Ruby Ann Laguna, Kendall Sabande, Lourdes Telo Taba, Carla Christine Vargas, Lawrence Vargas Jr., and from Mindanao, Eileen Kagaanan, Tolly Emil Lahoy Lahoy, Tristan Christopher Lopez. Our 52 graduates for year 2 batch 1. A round of applause for this achievement. Likewise, we'd like also to call in John Kevin De Vera from the Municipal Health Office of San Jose, joining our 52 graduates. Again, a round of applause for everybody. Now, each of our graduates for batch 1 for year 2 will be receiving a certificate of completion. Allow me to read University of the Philippines Manila College of Nursing, a World Health Organization collaborating center for leadership in nursing development. I will award the certificate of completion to our public health nurse scholar who has completed the NurseLEAD leadership course for advanced practice in public health nursing, given this 29th day of July 2022 with a duration of 148 hours and given a credit of 45 units. Signed, Assistant Professor Josephine Cariaso, Program Coordinator, and the Director and Dean of the College of Nursing at the University of the Philippines, Manila, Professor Dr. Sheila R. Benito. So again, to our 52 graduates from across the regions of the country, our greetings on this achievement of yours. Now, we would like to acknowledge the partners who made this project possible. So on behalf of the team, we would like to award this certificate of appreciation to Johnson and Johnson Foundation Global Community Impact for sharing their invaluable service as a corporate partner in the NurseLEAD Leadership Course for Advanced Practice in Public Health. Again, the certificate, signed by the Program Coordinator, Assistant Professor Josephine Cariaso, and Professor Dr. Sheila R. Benito, Dean of the College of Nursing and Director of the NurseLEAD Project. Same certificate is also awarded to Johnson & Johnson Philippines, to the Department of Health Human Resource Development Bureau, so again, our heartfelt gratitude to all our institutional partners for making this possible for our nursing leaders. At this point, let us hear it from our very own graduates to deliver their message of thanks. Let's call on the virtual floor, Ms. Annalyn Banikid.
Blessed day to everyone. What an honorable moment it is to be here standing in front of you as a representative of each graduate who attended and successfully finished this course. Before I share my pride and joy to all of you, first let me thank God who was the first supporter all throughout this course. That through Him, we really cannot do anything, but because of Him, we are able. To the professors who undoubtedly gave their time, knowledge, and utmost effort to help us grow, to be as effective and efficient workers to serve our beloved community and country as a whole. Also, to the NurseLEAD coordinators and staff, thank you so much. We won't be able to make it if it wasn't for your dedication and passion in what you do to give us all a hand. To all my fellow course mates, thank you for such precious memories that we share. Learning together and learning from each other truly made this course enjoyable. To our family and friends who cheered on for us all, from the bottom of our hearts, we thank you. Now please, allow me to share with you my experiences in this course. No job is actually easy, especially when it is for the welfare of a lot of people that is depending on you. As a public health nurse, not only do you need to be ready to attend to those who are needing your assistance, but also you need to multitask every now and then in doing reports and talking to people who are in charge of any matters that may arise. At the end of the day, we go home with our hearts loaded of how we can do more to be of service to others. NurseLEAD has been an eye-opener to me in such a way that nurses like me should not be limited behind their stations or workplaces doing their routines every day. That we, in our simple way, can do more by extending knowledge and help make a way and solve problems that others don't see. This course developed in us a sense of responsibility and accountability that goes beyond and reaches more. This course taught me a lot, especially in organizing a project that is feasible and effective. Some of what I learned is how to stand out and stand for the people, especially in your designated community, through initiating and being a leader. As a leader, we take the responsibility to extend the help and bring it closer to the people, especially to those whom are in the far-flung areas within and beyond the community. By becoming the bridge, we build and stabilize not just a stronger health system but also a healthier and happier community. Since times are also changing fast, nurses need to adapt to better serve. Thus, applying our knowledge to lead and instigate with the proper tools, we'll be able to do it. Second is how to manage specifically and interventions that will bring solutions to the problems that we see. Fact is, not all angles are seen in one position, so we as nurses are also needed to bring into the table all the possible solutions to satisfy those needs. We need to know how we should do things and do it strategically to carry out our goals. For a very complicated healthcare system, it becomes part of our job to break it down for the people to easy access and understandable things for them to keep up. This too is a part of managing process. Last is about collaboration. One cannot do all the work and also do not have all the knowledge to do so. As a part of an organization, we all have the roles and tasks. With all the brains and different perspective each one has, together it can make ideas that can support the goals of nurses. That is, to provide service that is without compromise and with passion. As for my current role, NurseLEAD has definitely provided me not just an opportunity to gain more knowledge, but also to perform my job more effectively. I've learned a lot from this course and also my capabilities to adapt with our current technology and integration pave a way for me to understand and see things from different views and aspects. Now, with what I've taught, I believe I am more capable to serve them better. Finally, my message to the course team and the sponsors of this wonderful course, again, my utmost thanks to you all. Empathetically speaking, I know that organizing such event is so meticulous and tiresome, with all the details needed to be done. We don't dare say that it's been an easy job for you all, experiencing a bit of this when our capstone project was given us. I believe it was nothing to what you have prepared and have overcome. So I, in behalf of all the graduates, would like to give you all our appreciation. A way of paying you back with all the sacrifices you've done would be to apply all that we have learned for all the betterment of our beloved community and country as a whole. May God continue to enrich your hearts as you continue to help the next batches of nurses. As we successfully go on with our task, please remember that our success is also yours, for we've learned from the best. Once again, thank you and congratulations to all my colleagues and co-graduates.
Thank you, Annalyn. This time, let's hear it from the graduates of the Visayas, calling on Kendall Sabando for his message.
Good day to each and everyone. I hope everybody is doing great. And now we are on the completion ceremony of NurseLEAD Leadership Course for Advanced Practice in Public Health Nursing by the University of the Philippines, Manila, College of Nursing, Year 2, Batch 1. And this is my words of gratitude and a way of saying thank you. And this is Kendall M. Sabando from Team Mountain, and this is my voice over. We go by a saying, a leader is one who knows the way, goes the way, and shows the way. From John Maxwell. What is my view on the NurseLEAD course? The Advanced Leadership course is based on sharing of information by nursing leaders that is intended to develop capacities in key decision makers, aiming to accelerate outcomes and drive adjustments in competency. And by that, what are my learnings from the NurseLEAD course? I have developed leadership opportunities and possibilities in those pressing priority public health issues. The course taught me how to be a change agent by strengthening my personal leadership behaviors while also maintaining a balance between the attitudes and practices of a project coordinator. This enabled me to discover how to drive transformations. And after the NurseLEAD course, how will this help me in my current role? I have a high level of confidence that I have gathered up some useful knowledge which is very much required at this time, notably in management of various programs, initiatives, and activities in relation to adjusting to the new normal. There are certain programs in which I am able to participate, but there are others in which I am unable to do so on my own. It is similar to making an investment in expanding my existing knowledge and skills. What is my message to the course team and sponsors? With a grateful heart, I'd want to convey my appreciation for all of the learnings and insights provided by engaging passionate nursing leaders and luminaries, as well as the stakeholders who made this remarkable course possible, as you all offered a common language and shared approaches. You brought the principles to life within the experienced public healthcare framework. We will all utilize practice-based techniques that have been carefully designed in order to produce the support, even advocacy, that is necessary to start and carry out programs. This support is essential in order to be successful. And with that, from the bottom of our hearts, we would like to say a very big thank you. Kita-kits soon. NurseLEAD Summit on May 2023. We will be waiting for you.
Thank you, Kendall. At this time, let's hear it from the graduates of Mindanao. We call on stage Eileen Kadaanan.
Hi! Good day! Maayong adlaw sa tanan. I am Eileen Gook Kagaanan po, a Public Health Nurse 2 of the Rural Health Unit of Calamba, Misamis Occidental Northern Mindanao. So when I first knew about the NurseLEAD course up into the preparation of the application requirements until I got in, right then and then I knew and I realized that this course is a timely blessing, because I envision it as something that will greatly help me in rejuvenating and recharging my unmotivated self po towards public service, because parang kinain na po ako or naubos na po ako sa pandemic and for almost 3 years of COVID-19 response. So with the course module from Module 1 on the Leadership in Public Health Nursing to Module 2 on the Managing of the Public Health Nursing Interventions up to Module 3, Collaborations in Public Health Nursing, parang na-excite po ako in spite of the workload, work overload, and the multitasking as a public health nurse. Parang may nilook forward po kami sa mga synchronous session and as asynchronous session. For the asynchronous session, we have the video lectures, the handouts po in each module, the integration activities, at the same time po yung pag-conceptualize po ng capstone project. And with the asynchronous session po, we get a chance to interact with the brilliant resource speakers, at the same time shared insights, comments, suggestions, and even reflection po sa mga capstone project during breakout session po with our facilitators. So with that, it opened my heart and my mind, and it molded me back on my feet and being compassionate again towards public health service. So as much more on improving or enhancing myself in leadership skills, the nurse competencies that I have and I should have possessed. Same with the interpersonal, interprofessional, the communication skills, and of course in fostering collaboration with our partner agencies and the relevant or related stakeholders in the delivery of primary care health services and the population-based health programs po. So as I go through with each module, I applied my learning by imparting knowledge to my coworkers at work. So, in every module sessions po, nag-share din po ako sa mga, nalalearn ko sa mga sessions. So, with my doctor, with our doctor, MHO, the nurses, the midwives, the medtechs po, and the pharmacists as well po. Para nag-learn kami, nag-learn po kami together. At the same time din po, nire-raise po namin yung self namin. So with that, as a team, we can work together in the delivery of the quality healthcare services to our community. At the same time po, mas mapadali po ang pag-achieve po ng main goal po namin, which is the better health outcome po sa mga constituents po namin dito sa Calamba, Misamis Occidental. So with that, ang laki po ng impact ng NurseLEAD course sa sarili ko po at sa mga workmates ko po dito sa workplace po namin. So I realize, indeed, we are not just nurses, nurses na for pandemic lang, frontliner lang during COVID-19 responses, or nurse lang. We are nurses. We are way more influential. We can lead and, of course, make a difference in our community. We are nurses that we can make everything work together. So, to the University of the Philippines College of Nursing in partnership of the Johnson & Johnson Foundation, to our course team, to leaders, facilitators, to the genuine resource speakers, as well as the teaching assistants. Walang hanggang pasasalamat po. Maraming salamat po for giving us this chance, for giving me this chance to be part of this very rare opportunity and privilege po. Nakaka-inspire po at nakaka-motivate po yung deep love and genuine understanding niyo po for public health. And of course, to my batchmates in this course, congratulations po for completing this course. At the same time po for making this far. Thank you for sharing your knowledge, your perspectives, your insight, and every reflection. So it feels so amazing to have another ideas from other nurses in all parts of the Philippines. So with that, let's keep the fire burning as public health nurses towards service. God bless us all po.
Thank you so much, Eileen. And last but not least, we call on Homer. Okay, Ritas, to represent the batch coming from the National Capital Region.
I believe on the saying that not everyone is born a leader, but anyone can be one. This course proves that leaders can be molded and built through a good foundation, a series of trainings, and one of the biggest factors is exposing them to future leaders. Also, this course aims to strengthen the nurse competencies in managing primary care service and application of population-based program, and expanding the roles and responsibilities of nurses in turning the healthcare system in more advanced manner. With this kind of course, nurses are able to fulfill excellence in nursing profession by adopting advanced managerial decision-making and development of confidence in terms of handling challenges in their community and collaborative organization. I hope this course will go further because this course is not only focused on individual development, but rather than developing individual to a greater purpose. NurseLEAD course taught me all the equipment that I need to carry to become a great leader. The strategical and innovative way of planning and design thinking are one of the special aspects in creating effective program. The population-based approach taught me how the universal healthcare will anticipate to bring a wide range coverage and accessibility, not just based on individual needs, but a greater impact on our current healthcare system. Also, how can we effectively deliver the 10 public health service through creating capstone projects that help robust our effort in disseminating health promotion, and disease prevention. First time but not the last to recognize the role of financial manager. Learnings regarding how this profession can will be well managed using project management and financial planning during our lecture in PMOC. According to Dr. Mandibel, the COVID-19 pandemic highlighted more than ever how important strong leadership is for nursing profession. The pandemic forced the nursing profession to respond to a rapidly changing and increasingly complex healthcare environment. And as a disease surveillance officer and a health promoter, it is essential to develop and hone my fundamental leadership skills to have a positively impact to my patient's outcome, redefine my scopes and responsibility, and be a role model to my healthcare team in attaining our common organizational goal. Also, this NurseLEAD course serves as a catalyst for me for a change and innovation as a nurse leaders from all tier of nursing responded to a new challenge that COVID-19 pandemic presented. First, I want to thank the whole University of Philippines Manila College of Nursing and Johnson & Johnson for creating an innovative program which can help develop and upskill nurses to advanced level of healthcare profession. I can think of any way to present my gratitude from the dean, from the advisor, lecturers, and role models from the start of Module 1 to the last. Secondly, on our Team 4 Taal, Sir Erwin, Ma'am Jelay, Sir Harold for their boundless effort and ceaseless patience in replying to our reflection and giving us advice regarding our capstone projects. Lastly, to my fellow future leaders for giving me insights and sharing your experience and programs into your community and hospital. Thank you very much, everyone, and forever be blessed to be part of a future nurse leader. Kudos, everyone.
Thank you, Omar, and thank you to the rest again of our graduates for sharing their message of thanks to the team and to everybody who is part of this project. So we'd like once again to invite everybody to join the National Association of Public Health Nurses, and we look forward, to working with all of you in shaping the landscape of healthcare and creating a meaningful impact to our communities. So much much has been said about the summit. We're all excited to meet all of you face to face on March 2023 for the NurseLEAD So see you all in Clark, Pampanga on March 2023. To officially conclude our session for today, we'd just like to remind everyone that the next batch, for NurseLEAD, year 2, are on the screen. For batch 2, we have the program running August 26, October 7, batch 3 for October 21 to December 2, and the last batch for year 2 will be on January 13 to February 14 of 2023. So please spread the good news to your peers, to people, by the way, in your respective workplaces, and join us, in this NurseLEAD advanced training on leadership in public health nursing practice. And at the same time, we'd like to remind everyone to please don't forget to accomplish our evaluation survey for the course. The link is shown on the screen. And at the same time, you can check the link on our course site using the LE. So we thank everyone again for joining us for this 148 hours of engagement. And as mentioned earlier, to officially conclude our activities for the first batch for year 2, may we call on the virtual floor one of our resource persons and Associate Professor of the College of Nursing at the University of the Philippines, Manila, for the closing remarks. Associate Professor Luz Barbara Pambig.
Isang malugod at mainit na pagbati sa lahat. Dr. Carmen Cita Padilla, Chancellor ng UP Manila, Dr. Sheila Bonito, ang aming mahal na dekana sa UP College of Nursing, Dr. Prechel Tolentino, representing the Department of Health, Mr. Manish Andani, President and Managing Director of our partner, Johnson & Johnson, Ms. Wen Yi Tan of J&J Global Community Impact, NACNI President Cora Año Nuevo, our NurseLEAD resource persons, facilitators, and teaching assistants, mga kaguruan ng UP College of Nursing, at ang 52 public health nurses na narito ngayon upang ipagdiwang ang isa na namang napakahalaga at masayang okasyon, ang pagtatapos ng unang pangkat ng NurseLEAD Leadership Course for Advanced Practice in Public Health Nursing Year 2. Sa kabila ng malaking hamon ng kasalukuyang panahon, pandemya, bagyo, baha, at ang lindol nitong nakaraang Miyerkules, nagawa pa rin ng ating public health nurses mula sa iba't ibang rehiyon na maisingit ang pag-aaral na ito. Bagamat hindi na ito nakakagulat, tunay pa rin nakamamangha ang kanilang galing, husay at dedikasyon sa pagpapatupad ng kanilang gawain habang masikhay na nililinang ang kanilang kakayahan, hindi lang para sa kanilang sariling kagalingan, kundi sa ikagagaling ng kani-kanilang bayan. Maraming salamat sa inyong pagsusumikap para sa sarili at para sa bayan. Empowering yourselves to become nurse leaders will allow you to ultimately help empower the people. Our gratitude also extends to the local government units, which allowed official time for our public health nurses to participate in this course. We hope that the capstone projects that your nurses made will see fruition as they are considered their best contribution to making the UHC work in your locality. We also thank our precious partners, the Department of Health through Dr. Prechel's office, for J&J for the funding support that made possible for UP Manila to translate honor and excellence in our public service. With Chancellor Padilla at the helm, the Health Sciences Center will strengthen its position in helping build an excellent yet relevant and responsive healthcare delivery system for all. Hindi mangyayari ang lahat ng ito kung walang nagkakaisang pananaw at tunguhin nating lahat. Hindi po nagtatapos ang ugnayan natin sa araw na ito. Bagkus, ngayon ay simula pa lamang ng ating pagkakapit-bisig upang makamit ang mithiin ng UHC at primary healthcare tungo sa tunay na health for all. Muli, isang mainit na pagbati sa ating nagkakaisang tagumpay.
Maraming salamat po, Ma'am Luz. At muli, ang aming pagbati sa ating 52 graduates for Year 2, Batch 1. So, ayun din po, nais ko namin pasalamatan at kilalanin sa pagdalo sa ating closing ceremony ngayong hapon. Ma'am Je Valenzuela and Dr. Castor Palaganas for joining us. So muli po, maraming salamat. At tulad po rin nasabi ni Ma'am Luz, hindi dito nagtatapos. Patuloy lang po tayo. Sa paglilingkod para sa bayan. So buksan na po natin ang ating mga camera bago natin makalimutan. Makita natin ang tunay na ngiting tagumpay. Ate CJ, Ate Julia.
Good afternoon po. Ayan. Nire-ready ko lang po yung screens natin. Ayan, may 3 po tayong panel. Sige po, mag-ready po muna tayo. Okay, so 1, 2, 3, smile. Isa pa po. Okay. Sa susunod po na panel. 1, 2, 3, smile. Okay, isa pa po. 1, 2, 3, smile. Okay. Okay, last panel na po. 1, 2, 3, smile. Smile po ulit. Okay, ayos na po. Thank you.
Thank you, Julia. Salamat po muli sa lahat. Congratulations!